There's a huge collaborative effort underway at PrevientMD that brings in the physicians and we have an amazing team of people that are hard at work to provide an approach to preventive medicine that we can deliver at a reasonable cost.
We know that most diseases can be avoided. Death will happen, but we can avoid chronic decline in the vast majority of situations. Previent fills that void. It's going to be something that's cost-effective. It's something that's medically sound, it's evidence-based, and it is going to change the entire direction of medicine if this really will expand to a broad base of patients.
It's the philosophy of PrevientMD. The philosophy is all about intervening early in the game. Number one. Number two, something else that is fundamentally wrong with medicine in America today is that the patients take absolutely no responsibility for their own health. They come to my office and expect me to cut something out or give them a pill to make them better, when in fact they are responsible for why they are sick. Their lifestyle is responsible. And the thing that PrevientMD does is we are a team of physicians, but part of that team is the patient themselves, making them responsible for improving their own health by helping them to change their life. And that's the thrust of PrevientMD that attracts me the most at this point.
How is it that life stage health management has impacted or changed your thinking from what you've learned in the past?
Well, I think that life stage health management hasn't really changed my thinking. I think that I found a company or a team that is exactly in sync with what I've been thinking for a very long time. So it's just really a very nice fit for me, because the philosophy of this company directly addresses all of the things that I see wrong with the practice of healthcare in this country.
I think that, people like to say that we have a healthcare system, and there really is no system. It's more of like a Rube Goldberg machine that's becoming infinitely more and more complex and more expensive, and people are just being sicker. There is no system. It's totally broken, and we'll see what happens in the future. This is definitely the future of the way that medicine should be administered, but the politics of the United States, it's hard to say what will happen in the future, but it's definitely broken.
So, with all your options, what prompted you to join PrevientMD?
Well, wanted to do this at life stage management medicine, and obviously, especially as a younger physician, definitely want the support and help of people who have experience, both on the business side as well as obviously the medical side. I don't think any physician should practice on their own. It's all about teamwork in healthcare, I think, and so you really need to have mentors and people to ask questions to, and I have a lot to learn still. So it's a terrific fit for me.
I signed up for Previent because I felt it was an opportunity to finally fulfill my dream of being the doctor that I want to be. I don't want to rush through patients. I don't want to have that constant pressure on my back to stay on time, and I'm not staying on time because I need more time to explain things to my patients. I need time to give this quality care. Quality care takes time. Quality care takes one-on-one education. You can't do that in a 7-minute visit. You can't do that in a 15-minute visit. So Previent basically was this godsend where I said, wow, I can finally, hopefully, do my concierge medicine in the areas I'm in now, which are middle-class areas. Not the high end where all the rich of the rich are, but to apply the Previent philosophy to everybody. And for me personally, on a professional level, this is what I want. I have a desire that this fire that's burning inside, now I can actually do it. So that's why I joined. I would recommend Previent to any of the docs who course, thinking about getting out of the rat race of traditional medicine right now and wanting to fulfill their dream of actually being a doctor. Previent has given us the opportunity to, one, make it affordable, and two, I don't think the docs realize just how much is going on behind the scenes with Previent, with you, with Ken, and everybody else, Francesca, the whole team. I didn't realize, I first thought I was buying a package. I'm not buying a package, I've actually joined a team. And that's what I'm excited about. I am now part of the Previent team and very well excited about it, and ready to, I think the docs need to know that this is, if there was ever gonna be a chance, ever, for a doctor to do concierge medicine, to do what they want, what they went into, it's going to be through Previent.
This is the future of medicine. This is going to make all the difference in the world if we can have physicians understand that this should be part of their armamentarium. Let's talk about prevention. Let's not wait for the disease to happen. Let's get back to the time where we are really making a difference in their life, and we're not just taking care of a part. We are taking care of the entire person.